Hello, my name is Bienvenu, and today we're going to talk about the different choices of oxygen deliveries, about the different percentages, and the advantages and disadvantages of either. Also, we're going to talk about the complications of oxygen therapy. First off, I want to talk about the different types of oxygen delivery devices there is, and the most common ones. Of course, you have your nasal cannula, which is the one that just goes around. That is going to be more the gold standard. Just more, every patient is usually going to start there because anytime you deal with oxygen, you want to start the least invasive. You want to start with the lowest amount of oxygen to get the O2 saturation at the right dose or right percentage. So the nasal cannula will deliver anywhere from 24 to 35% oxygen, and the flow of that is anywhere from 1 to 4 liters per minute. The next thing is a simple face mask that is going to deliver anywhere from 40 to 60% oxygen, and it's going to be greater than 5 liters per minute. The next one is the non-rebreather mask, which is the one that has a clamp, has a little bag on it. That's going to deliver greater than 60% oxygen and a flow rate of greater than 15 liters, or excuse me, 15 liters. And the Venturi mask is you're able to adjust that one. It's anywhere from 24 to 60%, depending on the patient's status. Uh, with the Venturi mask, I want to bring to your attention. So you don't want to go straight from a nasal cannula all the way at 4 liters, giving say 35% oxygen or the max oxygen out of the nasal cannula, and go to a Venturi mask and have it at the lowest part because it's going to be actually less oxygen to the patient. So if you have start the patient out on a Venturi mask, excuse me, let me say that. If the patient's on a nasal cannula, all the highest it can go, okay, and the O2 is doing nothing. You put them on a Venturi mask, and at the lowest, the patient's going to decline. You're like scratching your head, like, okay, yeah, this is not. I wonder what's going on. Think about it. The oxygen is actually less than what it was initially getting from the nasal cannula. The next one is just a high flow nasal cannula. That also can be set anywhere from 21 to 80%. Um, these guys, you really are going to focus on nasal cannula, non-rebreathers, um, Tory mask, simple mask. The high flow, um, sometimes it just really depends on, I guess, certain areas or whatnot. But if you're doing a high flow nasal cannula, then there's another intervention that is better, a different type of mask. So you won't really see that one very often, the high flow. Um, and of course, the ventilator. Ventilator can breathe 100% for you and deliver the highest concentration of oxygen to the body. It can breathe on your own, and the rest of these guys is only going to be able to provide oxygen if you're able to like breathe in the oxygen. If you can't, if you don't have the ability to actually um, inhale, then these other oxygen devices that I listed before are not going to work. The ventilator would be able to provide the oxygen the patient would need. So oxygen is really tedious. You can't have too much oxygen too fast, and so there's going to be certain complications with oxygen that we need to be familiar with. Oxygen toxicity, um, drying of the mucosas, and a lot of people don't really think about that. Or infection. And like, okay, well, for infection, how are you relating this to oxygen? So let's start with the oxygen toxicity. So oxygen toxicity, and also one more, absorption atelectasis. That's an important one. So basically, with that, let's start with that. Absorption atelectasis. So if a patient or a provider is giving 100% oxygen to a patient and their stats are really low, if you're delivering 100% oxygen, the nitrogen in the alveoli is washed out and it's replaced by nitrogen. So the oxygen is extremely soluble in the blood and it diffuses very quickly into the pulmonary vascular, so that not enough gas is left in the alveoli, and the alveolus collapses. So that's a problem there. And also, another thing with oxygen management and toxicity, you gotta depends on what's going on with your patient. If your patient has COPD and their stats are stats is at um, 89, well, or 90, okay, that's their normal. They're used to running at that level. You don't want to go cranking up the oxygen to get it up when that's their normal. So you really oxygen. I know textbook says greater than 95% or 95 and higher, but it really depends on what your patient's normal is. You don't obviously want them at 60 or 70, but then you don't want to increase it so fast where they lose the ability to breathe on their own. And we don't want, and all that would be all the complications that I discussed earlier. Now to the dry mucosa and infections. Those guys kind of link together. Oxygen is obviously coming in, right? And it's going to dry out anywhere the route is going, okay? And so it dries the mucosal membranes. Well, once that dries out, it may crack. Well, over time, that's an entry for infection or bacteria or whatever. And so we really need to be cautious of that, inspect the airways, and make sure that we don't see any obvious bleeding or cracks that could potentially result in an infection. Also, one other one I forgot to mention earlier, a fire hazard. Lots of patients, especially these little old men or old ladies, they're in their wheelchairs and they have their oxygen on and they're just out there smoking their cigarettes. Well, oxygen is very flammable and it will catch a fire and it will really blow up in your face. So it's really important to teach your patients because a lot of patients they are kind of sometimes hard-headed and just real strong, and they're going to think that they're going to do what they want to do. But we have to educate them that this is serious and that it can potentially happen to you, and that um, it has happened to others. So that's basically oxygen delivery, oxygen complications, um, the amount of percentages of oxygens we discussed, the liters. That's pretty much all of oxygen um, in a gist. And it really, again, it really depends on what your patient's diagnosis is. COPD is obviously a little lower. Asthma or all these different factors play into this. So really read your patients and you can get familiar with what their normal is and treat from there. And that is oxygen. And my name is Bienvenu, and thank you for watching.